What if I told you that some of the health checkups your doctor insists on after age 70 could actually do more harm than good? Every year, millions of seniors walk into clinics believing they're protecting themselves, when in reality, they might be stepping straight into a medical trap. Shocking new research shows that up to 37% of routine tests in older adults lead to unnecessary treatments, dangerous complications, or even lifelong side effects. And here's the kicker. Almost no one over 70 knows they're at risk. In fact, according to British Medical Journal, BMJ, 2019, over 60% of prior surgeries in people over 75 led to complications, many without ever rupturing. In this video, I'm exposing the 6 health checkups you should avoid after 70. The very ones that could push you closer to surgery, stroke, or even cancer. One of these checkups, the number 1 on our list, actually causes 5% of all cancer cases in the US, which is equal to the number cases causes by drinking alcohol every day. Why aren't doctors talking about this? Why is the truth buried in medical journals instead of shared openly in clinics? You won't hear this from your clinic. You won't see it on a billboard. But the truth is buried in the science. Stay with me, because what you're about to learn could change the way you approach your health forever. And trust me, you won't believe what made it to number 2 on this list. Let's dive in.
The information in this video is for educational purposes only, compiled from open sources, and does not substitute medical advice. Please consult your doctor for any health-related concerns.
List. Let's dive in. And there's a reason this is number 6. The third test is the heart stress test. This is one of the most common tests for older people who say they are somewhat weary, have modest chest tightness, or feel like they are not themselves. A cardiac stress test checks how well your heart works when you walk on a treadmill or take drugs that makes you feel like you're exercising. Its goal is to find any blocked arteries. But beyond the age of 70, this test may frequently do more damage than good, especially when it is done on patients who don't have any clear indicators of cardiac disease. The problem is that it may set off false alarms and lead to cardiac operations that aren't needed, yet are nevertheless dangerous. The worry is about how accurate it is. Research reveals that for those over 70, the percentage of false positives, when the test says there is a cardiac problem that isn't really present, can be as high as 40%. This might mean further tests, including angiograms and perhaps unnecessary stents or bypass procedures. A big research in JAMA Cardiology in 2017 found that more than half of the stents put in following stress test recommendations were given to people who didn't have any significant symptoms or get any better from them. Because of this, these individuals did not live longer or feel better on a daily basis. What a lot of people did encounter, however, were more bleeding, renal problems from contrast dyes, and longer stays in the hospital. For example, Raymond was a 75-year-old retired postman who liked to stroll every day. He said that climbing hills made him a little weary at a regular checkup. His doctor decided to perform a stress test just to be safe. Raymond was sent for a catheterization when the test findings weren't clear. This means that a tube was threaded into the arteries to search for obstructions. There was a little constriction, therefore a stent was put in. Raymond had renal problems that night because of the color they used. He had to stay in the hospital for 6 days and then have further therapy for weeks. Raymond's tiredness didn't get better, since it wasn't his heart. It turned out he only needed to drink more water and take longer rests between meals, which is usual in elderly people. So, if you're over 70 and not suffering common cardiac issues like chest discomfort when you move about, shortness of breath when you move around, or a notable lack of energy with modest exertion, a stress test could make things worse instead of better. A basic resting EKG, which tests your heart's rhythm while you are at rest, or a coronary calcium scan, which indicates whether hazardous plaque is present, are often safer and simpler options. These other options are less likely to steer you to therapies that you don't need. Let's go right to the 5 test and talk about why it might hurt your quality of life without you knowing it. The bone density scan is number 5. It seems straightforward at first. The scan is fast, painless, and doesn't use needles. You leave knowing whether your bones are likely to shatter. But here's something you probably won't hear. A bone density exam might typically make you more anxious than it helps after you become 70. A DEXA scan is a test that looks for osteoporosis by checking how strong or thick your bones are. For most older persons, particularly women, these findings nearly always show some bone weakening, even if your true risk isn't that great. That's because as we become older, we naturally lose bone mass, just as we gain gray hair or wrinkles. This is a regular thing. Even yet, a lot of older people are given medications like bisphosphonates to help their bones become stronger. But these drugs may cause major difficulties, such inflammation of the food pipe and death of the jawbone, which is an uncommon but dangerous adverse effect. This is why this is bad. Research demonstrates that using medicine to address modest bone loss beyond age 70 doesn't do much to stop fractures. The Journal of the American Geriatric Society released a research that followed more than 1,200 women over the age of 70. There was just a 0.3% lower incidence of fractures after 5 years for those who used bisphosphonates. That difference is quite minor, so it's not going to change your life. But these ladies were far more likely to have bad side effects, such stomach pain, inflammation of the esophagus, and strange bone fractures. Think about Rose. She used to be a piano instructor and is now 76 years old. She was sent for a DEXA scan at her yearly appointment. She had never fallen, didn't feel any discomfort, and walked every day. Her findings indicated osteopenia, which is a little decline in bone density, not osteoporosis. Her doctor instantly gave her alendronate, which is a kind of bisphosphonate. 3 months later, she had bad heartburn and jaw discomfort. She hadn't played the piano in weeks when she came to us. We told her to stop taking the medicine and instead eat a lot of calcium-rich foods, like leafy greens and sardines. Do strength-building activities with resistance bands, and take vitamin D. A year later, she was back on stage, playing concerts with stronger legs, better balance, and no broken bones. A quick scan may not seem like a big deal, but for those over 70 who haven't had any falls or broken bones, making modifications to their lifestyle is usually a better idea. A 2022 research by Osteoporosis International found that becoming stronger, better balance, eating healthily, and addressing a vitamin D deficiency may cut the incidence of fractures by more than 20%. Don't allow a test result make you get therapy you don't need. But, as you'll discover, there's another sort of scan that may lead to something much worse: brain surgery. Let's go on to the next thing. Brain MRI for memory issues is number 4. It's normal to worry when elderly people start to forget things or become confused more often. A lot of individuals are afraid they could get dementia or Alzheimer's. Because of this, physicians will typically do a brain MRI. But the truth is that MRIs, which show a lot of information about the anatomy of the brain, don't always provide patients the unambiguous answers they want. Brain MRIs for most persons over 70 only show typical symptoms of aging, including little white spots or modest shrinkage, which are usual in older people. Seeing these alterations on a scan, on the other hand, might cause a lot of stress, more testing, and even surgery. These kinds of things don't usually assist with memory problems and may even make them worse. In 2021, Neurology Today released a research that examined at more than 3,000 MRI scans of adults between the ages of 70 and 85 who said they had problems remembering things. The research discovered that 86% of the people had some form of brain problem, but just 3% of those problems were curable. So almost everyone had to deal with the dread of being informed something was wrong, even when there wasn't really a problem. Even more worrying, around 12% of people had invasive tests like spinal taps or biopsies done solely because the scan findings were inconclusive. For instance, George, a 74-year-old retired engineer, came in worried because he was losing stuff and forgetting names. His doctor ordered an MRI, which showed some abnormalities in the white matter, even though he was still intellectually bright. George was troubled by this. He stopped driving, stopped going to church, and over time he got more frightened. But when we gave him a typical cognitive test, his thinking was completely normal. We told him that the changes in the MRI were normal for someone his age, and we told him to work on things like getting adequate sleep, drinking water, and performing brain workouts instead. His memory became better in only 3 months, and he felt like himself again. The truth is that a brain MRI is not very helpful for moderate memory issues unless the individual is having major neurological disorders, such seizures, unexpected changes in personality, or a quick loss of everyday skills. A cognitive screening test is a good place to start. It's a basic paper and pencil examination that assesses memory, attention, and problem-solving abilities. It's simple, cheap, and keeps people from becoming stressed out by false alarms. Get ready, because the next exam in the countdown is one you've probably taken more than once. 3. Regular abdominal ultrasounds to check for aneurysms in seniors who don't have any symptoms. Not every quiet danger deserves a big fix. Sometimes getting too close might make things worse. An abdominal aortic aneurysm, AAA, is a bulge or widening in the wall of the aorta, which is the major artery that runs through the abdomen. Most aneurysms in older individuals develop extremely slowly and never constitute a concern, but if they do burst, they may be severe. Still, many people over 70 are given regular ultrasound tests for aneurysms, even if they don't have any symptoms or major risk factors. The issue is what occurs once something little is discovered. Surgery is seldom done on small aneurysms, especially those less than 5 centimeters, although they frequently cause years of repeat imaging, anxiety, and concern that isn't needed. Once a diagnosis is given, it becomes a mental burden that seldom leads to any real medical benefit in this age range. The dangers go up when surgery is done. Elective type-2 repair in older persons has a significant risk of consequences, including as heart attack, stroke, kidney damage, and death, particularly in those who already have heart or lung problems. A 2014 systematic analysis in The Lancet concluded that PA screening did not lower the overall death rate in males over 75 and did not help women of any age in any way. The United States Preventive Services Task Force, USPSTF, says that men over 75 should not get regular PA screenings since the benefits are few and the risks are significant. Also, a research from 2019 that was published in the British Medical Journal indicated that more than 60% of older persons who had LTOA surgery had at least one major problem, and many of these aneurysms would never have burst. Think about Walter, who is 79 years old and used to be a teacher. He felt okay, but at a regular checkup, he decided to have an abdominal ultrasound. The scan showed an aneurysm that was 3.8 centimeters wide. The doctor said there was no need for quick action, but Walter was too scared to think about anything else. He stopped working out, stopped going out with friends, and cut down on the things he did every day. 2 years passed, the aneurysm had not developed, but Walter's health and confidence had become much worse. For seniors who don't have any symptoms, a family history of aneurysms, or a history of smoking, an abdomen ultrasound doesn't help much. In most circumstances, it's best to concentrate on your lifestyle, such keeping your blood pressure in check, getting active, eating healthy, and dealing with stress. Screening should not be done all the time. For adults over 70, doing less when it's right may frequently mean living better. The second one is a colonoscopy. You may not have thought this, but colonoscopies, which utilize a long camera to see into your colon, aren't usually the greatest choice for persons over 70. Doctors don't usually recommend them beyond age 75 unless there are obvious signs that you need them. The hazards gradually up as you become older. Getting ready for the exam is hard. It means taking powerful laxatives that may make you dizzy, harm your kidneys, or even make you dehydrated. The sedatives used during the treatment make it much more dangerous, and they may even damage the brain in older people. A lot of people are surprised that colonoscopies may produce difficulties on their own, such bleeding, rips in the colon, or problems with the heart rhythm due of the sedation. A research in JAMA Internal Medicine from 2019 looked at more than 1.3 million Medicare enrollees who were 70 or older. The statistics indicated that for every 1,000 colonoscopies done on persons over 75, just 2 lives were saved, while more than 20 people had major adverse effects. That means the danger is 10 times higher than the reward. Most polyps develop slowly and are tiny, even when they are detected. In elderly people, taking these polyps out might sometimes be more risky than leaving them alone. Think about Dana, a 73-year-old grandmother who managed a bakery with her daughter. She was okay. She wasn't in pain, she wasn't bleeding, her stool hadn't changed, and there was no family history of colon cancer. Even though she had just finished training, her new doctor urged her to obtain a screening colonoscopy regardless. She said yes. The doctor took out a little polyp during the treatment, and then Dana went home. That night, she had terrible stomach discomfort and passed out. Doctors determined that her colon had been punctured when she was brought to the hospital. She took 9 days to get well, lost 10 pounds, and never quite got back to her former self. We noticed that she had previously had 2 clear colonoscopies, so she didn't need to get another one. The U.S. Preventive Services Task Force says that most individuals should cease getting regular colon cancer tests at age 75. A stool test like a FIT, which you can take at home without any prep or anesthesia, may capture most concerning Boche instances and is considerably simpler. You should talk to your doctor about your alternatives, since once you start getting frequent colonoscopies, it's hard to stop. That takes us to the most common, hazardous, and perhaps deadly exam for seniors, a checkup that almost everyone has had. First, full-body CT scans every year. These scans are typically pushed by private clinics or executive health plans as a way to spot cancer early. But the truth is that full-body CT scans give you a lot of ionizing radiation. This is especially dangerous for those over 70, since the chance of unneeded testing, biopsies, and even surgery goes up a lot. It's strange, but there isn't any good evidence that having full-body scans on patients who don't have any symptoms truly helps them live longer. A single scan gives out 10 to 20 millisieverts of radiation, which is roughly the same as 500 chest X-rays. A modeling research published in JAMA Internal Medicine in 2023 found that the rising frequency of CT scans in the U.S. may now be related to up to 5% of all malignancies, placing their risk on par with alcohol. 1 in every 20 malignancies, in other words, might be linked to a scan that was supposed to keep you safe. That's not just not needed. It's scary. These scans may find natural indicators of aging, such nodules, calcifications, or cysts that aren't dangerous. But if they are found, alarms go out, and further scans, tests, and occasionally biopsies are done, which may make people anxious. For example, Marcus is an active 80-year-old who used to teach martial arts to other elders. He was feeling terrific, so he chose to have an advanced health examination at a private clinic. His scan showed a little 3-millimeter nodule, which led to a number of referrals. He was referred to an oncologist, had a PET scan planned, and then had a needle biopsy. The final report didn't find anything harmful, but the biopsy caused part of his lung to collapse, so he had to remain in the hospital for 2 months to heal. All of this for something that was never a problem. Experts now suggest that folks who don't have any symptoms shouldn't have full-body CT scans. The American College of Radiology says clearly that there is no proof that they benefit, and a good possibility that they will hurt. If you experience symptoms like losing weight for no reason, coughing up blood, or swelling that you can see, it makes sense to employ targeted imaging. Scanning your complete body without a good cause is like looking for gold with a landmine detector. You may find something, but the consequences might be worse than what you were worried about in the first place. It's better to pay attention to how you feel. If you're healthy, keep going to the doctor on a regular basis and only have tests when you really need them. Don't allow fear make you have tests you don't need that might do more damage than good. Keep in mind that these 5 exams may seem useful at first, but they might really create difficulties, particularly beyond age 70. Medicine can do amazing things, but it's not perfect. Sometimes, the best thing to do is to choose less. Always ask, what will happen next if this test shows something? If you don't know what will happen, or if the risks are greater than the prospective advantages, you may choose to push pause. And don't forget that the greatest way to remain healthy is to make good choices every day. Exercise, eat healthy foods, get enough sleep, and pick medical tests wisely. Have you or someone you care about ever had problems because of a test or treatment that wasn't necessary? What happened? Please tell us your tale and what you think in the comments. We'd love to hear from you. Thanks for watching.